Thank you so much. Thank you. Ladies and gentlemen, welcome back to the second half of day 2 here at Expand North Star, part of GITEX Global, and here being hosted at the new, very exciting Dubai Harbour venue. Hope you're enjoying all the facilities. This particular event is being hosted by Dubai Chamber of Digital Economy, and as you may have seen, from the brilliant experience that's been provided outside this particular hall, but also here as well. We've just had a wonderful whole host of speakers from around the world, international speakers gracing our stage, innovators, tech giants, entrepreneurs. And in keeping in line with that, we're continuing with the high level of speakers. The next session itself, it's entitled Navigating New Frontiers in Healthcare, what new models of healthcare will look like and how AI can make an impact. So as you've seen over the course of the last day and a half, and of course to the next 2 days, we're looking at that intersection of technology with other areas. So healthcare really is the focus here. And I'm going to be handing over to the moderator, Vishal Gondal, who's the CEO of GOQII. You may have seen him here yesterday. He'll be taking over this session. And our special guest is the CEO and co-founder of GOQII, flown in especially from Sweden here to Expand North Star. It's Johannes, Schildt. Please do give them both a very warm welcome. Thank you.
Thank you.
Hello, everybody, and welcome to Dubai, Johannes.
Thank you.
We are actually at a very, very interesting intersection of what's happening in the world and what's happening around us. We have just entered the post-COVID era. During COVID, we all saw how governments and everybody in the world were rapidly deploying digital tools to vaccinate people, to treat people, to do telemedicine. And what happened across the world is there was a massive acceleration in the adoption of digital health. And on the forefront of this is Johannes with his company and what they have done in Sweden and across Europe. So let us start by having Johannes talk a little bit about his background. He's one of the most successful entrepreneurs in Europe. He runs a multi-billion-dollar company, and we are very, very excited to have him here and listen to his insights. So over to you, Johannes.
Yeah, no, thanks for being here. Yeah, so I run a Swedish healthcare company called GOQII. It's impossible to pronounce it if you're not Swedish. So we go with different brand names in different markets. We're called Livy in the UK and France. We are now the largest digital healthcare provider in Europe, operating in 4 European geographies. My background is not in healthcare. My background is in tech and product. And I have, as everyone else, I've been a patient and have been fairly frustrated on how bad the healthcare system is structured. And we thought there must be better ways of solving it. So 8-9 years ago, we started to look into this space, launched in 2015. And since then, a lot of things have happened. So we now serve millions of patients across Europe, mainly doing purely digital healthcare, but also put a lot of effort in making sure that we link it all together, meaning that we link together digital healthcare into the physical world when needed. So yeah, that's what we do. At core, we're a technology and product company, but we now also operate healthcare ourselves at scale. So we have thousands of clinicians employed by us, doctors, nurses, psychotherapists, specialist doctors, etc. So yeah, that's what we do.
And what role did COVID play? Do you have a pre-COVID and post-COVID scenario of your business?
Yeah, no, good question. I think in one way, COVID was strange because healthcare usage was at an all-time low in most markets. No one was sick. Everyone was locked in and washed their hands all the time. So you had these massive peaks of demand, and especially Sweden was not a lockdown market, so we never had a lockdown. But in the UK and in France, you had those massive peaks of demand when they went into lockdown, and then everything was trending downwards because people were not sick anymore. But I think for us, the main thing with the pandemic, we obviously started long before that, was that it accelerated some of the policies policy shifts that was needed. A lot of the policy shifts in Europe started long before the pandemic, but it's definitely did accelerate it. And now, when we initially started, people said, no, you can't do this. This is not real healthcare. You have to meet in person, etc. Now it's obviously well anchored everywhere in all healthcare systems that what we do, digital healthcare, is a critical piece of the infrastructure. And I would say that the pandemic helped accelerate that for sure.
And in this entire process, could you kind of explain, because while we know that Europe has a very, very advanced medical care system, so
Yeah.
how is the European system or where you operate compared to the US system and what is happening in, let's say, UK or to some
Yeah.
extent the Middle East?
So in Europe, we're fairly spoiled with high quality care, but a lot of the markets are struggling with an accessibility problem, meaning it's fairly hard to get to see your doctor. And that was the starting point. That was my own frustration that, in order to see someone, you have to call a landline early in the morning, you have to travel long distances, and you usually have to wait for days or even weeks to see someone. So my first problem to solve was the accessibility part. And now we more or less have solved that in our most mature markets. With us, you have 24/7 access. I can talk to one of our doctors within a matter of minutes any time of the day. So what we spend a lot of time on now, as I said, making sure we knit it all together to secondary care as well. Then obviously, being a European company, the main payer of healthcare in all European markets are the public payers. So we have worked very hard and partnering with the governments across Europe, and the majority of our business is us operating in partnerships with the public healthcare systems. Then we also do private partnerships with insurance plans, etc. But we have been very successful in partnering with the public healthcare systems across Europe.
And what is the role of insurance? Is insurance a big part of this?
For us, the insurance market is just a small fraction of the total market in Europe. It is growing, though, given that the public healthcare systems are struggling. So with our UK business, around half of the business is us operating in private partnerships with insurance plans. But as I said, the majority of our business is us operating in partnerships with the public payers of care, governments.
Also, we are now entering an era of AI and chat GPT, and no question or no panel is complete without us knowing what you are doing with AI, because you are already operating at the complete cutting edge of health, right? You have 5,000 doctors or some very, very high number. And
Yeah.
how many patients or how many teleconsults do you do on a daily basis?
We do thousands and thousands of consultations every single day, and for us, it's very clear that we are in the industry, probably the industry that will benefit the most out of the recent developments in large language models. We apply it in the core delivery of our services. We already now have a few use cases in production where we use AI to help with diagnostics and basically automating all of the administrative tasks. We're working very closely together with Microsoft and OpenAI on this. So I'm super excited about it. And for us, it's not been about removing the clinician completely out of the equation. It's more about giving them superpowers to do more and improve the quality of care, and also removing a lot of the administrative burden that you do have in a lot of healthcare systems. But to simplify, we are in the business of selling complex conversations. That's basically what healthcare is about, and the models are fairly good at that.
So tell me, what was the initial reaction of the healthcare system? Because a lot of times we have seen that there is a resistance in the use of digital tools, especially in the healthcare world in many other regions. So what is your experience around this, and and especially AI, like people are afraid of AI and they're like, oh, this is going to take away jobs, or is it
Yeah.
going to give a misdiagnostics?
But I think, initially when we first launched, just sort of the pure concept of having remote consultations was something that people were fairly skeptical about, and it required a fair amount of, conviction to educate people that this is something that can be done. On the AI part, I think when we look at talking about our own clinicians, they love it. They do love it because it improved their efficiency a lot, and they can spend more time with patients and less time with administrative tasks. So I think it's also about how you obviously roll out new technology. I think where we can create a lot of massive value is when we combine our operations with technology. And the technology by itself is not really useful. It's like how you apply the technology on top of something. And I think that's especially true with healthcare, that you need to be really good at building the technology, and you need to be extremely good at applying it in the core delivery of the services that you provide. That's something that we are really good at.
The fact that you are at GITEX today, it's quite clear you are going to look at some of expanding now outside of Europe. So what are your thoughts around that, and What do you think about this region when it comes to healthcare expansion?
Yeah, no, I think it's a very fascinating region. You have really high ambitions with everything that you do here, and it's clear to me that the healthcare sector here should move directly into digital. Like if you were setting up a new nation, then you would obviously not start by building brick and mortar shops for healthcare. You would start by building a strong digital foundation, and that's something that we do. So yeah, we're definitely looking into ways of expanding our offering here and helping markets here to improve accessibility and efficiency in the healthcare sector. Um, yeah,
Interestingly, you also entered multiple markets in Europe, and while we all say Europe, but it's each market is different.
Yeah.
France is different, and then Italy and Spain and UK. So,
Yeah.
how did you navigate those challenges? Because UAE, when you come here, you will find people from all nationalities. Like Europe is there in this small region. Of course, you have to throw in India and other countries too. But how do you manage the diversity?
How do we manage that complexity? Yeah, it's a good question. I think it's a big part of our moat that we're good at handling that kind of complexity. And if you look into our technology and our operations, that is very scalable across markets, but obviously there are differences in the different markets. How we address the NHS, the National Healthcare Services in the UK is a difference, and how we address the public payers of France, for example. And that on a sort of a pure commercial side, and the partnerships that we need in the reimbursement system, etc., that is a market-by-market exercise. Yeah, it will require some strong partners to enter this region, I would say.
So there are a lot of entrepreneurs and companies here at GITEX. Do you have any advice for them if somebody is looking for, especially from a European context, because people are afraid of GDPR, and the entire Europe is somehow very, very complex for people to navigate. So what is your advice for any young entrepreneurs who are looking to enter the market?
Entering the Europe? Well, I think, and especially in healthcare, I think it's not sort of like you can't shy away from that complexity, but I do think that you can use that complexity to your advantage as well. And I think that is one of the reasons why we don't really have anyone we don't have any pan-European competitor. We're a pan-European company. We have local competition in all the different markets that we're in, but we do not really have pan-European competition. And I think that part of that is because of the complexity. So I think it's two sides of that coin. Like, it is complex, it is tough. You have to roll up your sleeves and really understand it, and especially in regulated markets as healthcare. But you can obviously also use that to your advantage because it's hard to compete. But I think building companies, this is just a lot of heavy lifting, a lot of hard work.
So recently we saw the bloodbath which happened with Babylon, who is one of the leading telehealth and digital health player on NASDAQ in the US stock market. And what impact have you seen of something of that sort in your world? Because overall right now digital health is having a little bit of a challenge globally.
Yeah, no, most definitely. So Babylon was one of our competitors in the UK that basically exploded a few weeks ago. And I think, mid, long term or short term is not really an issue for us because the demand is not going anywhere, and that just means that more demand is aggregated towards us. And I think that what we will continue to see is also that a lot of smaller companies are struggling. There were a lot of small companies popping up during a pandemic, all raised large seed rounds, try to outcompete us on different parts of what we do. They're all struggling because, as said, like what we do is fairly complex. We have, a really big underlying infrastructure, and that's sort of like you need to get to that point. Like you can scale to a certain point without adding too much complexity, but then you actually do need it. And we, by now we run 55 physical clinics. We have our offering live in multiple markets. We have hundreds of underlying contracts, and that is hard to compete with. But I don't think that will affect us that much. I think on the demand side, it's only good for us because the patients are not going anywhere. The patients still need our type of services, and now we have less competition, so that's a good thing.
So where do you see yourself as an organization 5, 10 years down the line, given the rapid adoption of technology, AI? Today what you're doing is telehealth, but have you thought about where will you go from here?
From an organizational perspective, yeah, I think that we'll in one way we continue to scale with employees on the healthcare delivery side. We will need a few more thousand clinicians, but on the headquarters side, I want to continue to keep it very, very lean because we are automating as much as we possibly can.
So we know the other very famous company from Sweden, which is Spotify. So we are hoping that Crew or Live will be the next big name coming out of Sweden and solving the health problem of the world. thanks a lot, Johannes, again for your valuable insights, and looking forward to having you set up soon in this region. Thank you.
Likewise, thanks for having me.
Thank you.